So Rachel Hildebrand and I are conducting a study actually on sub-concussive impacts. And these hits are not concussive hits, meaning they don't cause clinical signs of a concussion. We know in the concussion literature now that even one concussion, and definitely multiple concussions, can have really significant impacts on, again, individuals' ability to participate in desired life activities. What we're not as sure about now is what the implications are of multiple subconcussive hits. So the pilot study was funded internally through a grant that Rachel Hildebrand obtained. We have applied now for external funding to support the extension of this study into the fall season as well.
This fall, we will be including 20 student athletes from the football team, and will be asked to participate based on their starting status as well as their position. And within those 20 subjects, we will be asking them to complete the PACE auditory serial addition test. We will also asking them to be completing a SWAY test, and that looks at balance and reaction time. The student athletes will also complete a nightly symptom checklist. So this is sent to them via text message through our data management system, and the student athletes can go through and choose what symptoms they are experiencing. We do have some strategic partners that are helping us complete this study. The first is SWAY, which is a Tulsa-based company that is an application for the iPhone that is helping us capture balance and reaction time changes within the student athletes. The second and fantastic strategic partner would be the University of Tulsa Athletics, in their cooperation and their willingness to allow us to come to practice, help us on away games by taking the devices with them, placing the devices in the helmets, and generally just letting us be around and being very supportive of what we're trying to do to help the student athletes.
We hope that the findings of this study will help provide information that is clinically useful, so useful to the athletic training and coaching staff as well as to the players. So if we find, as we anticipate that we might, that these hits for at least some players are causing acute or short-term decline in cognition, balance or reaction time, or even an increase in symptoms. Our goal then is to figure out what activities during practice place the players most at risk for these hits, because that's something that is modifiable. That's something, if that information is in the hands of the coaches, they will be able to tweak maybe the order that they do activities in practice, or the techniques that specific players are using if there are specific players who are sustaining more hits than others. So really we hope that the information can be clinically useful and useful to the people out on the football field. And if we find that to be true, then we hope to disseminate the information more broadly through publication in scholarly journals.